Welcome to the Healthcare Provider Happy Hour. This is a safe space where we invite healthcare providers to unapologetically be themselves after the working day. My name is Jennifer George, and each week I will connect you with guests and stories that will help transform your stress to success and fulfillment. Are you with me? Grab your drink of choice and let's chat. Hey everyone, welcome to the Healthcare Provider Happy Hour. I'm your host, Jennifer George, and I'm joining you today with Babajide Oke. He is the CEO of Render Health. Render Health is a health technology company that helps transition healthcare operations in emergent markets to the digital age. They are currently in Lagos, Nigeria right now, helping the market there and the residents of Nigeria there. And Jide basically shares with us his story, how his vision has come to be, how he's continuing to grow it and serve the community as a whole, and also taking into consideration healthcare provider burnout as well as patient and provider communication. So grab your drink of choice, check out this episode, and join us. Welcome, Jide.
Oh, thank you. Thank you, Jennifer.
How are you today?
I'm doing good. I'm doing good. Tired, but keep it moving as usual.
Yeah, I see that. You're in Kentucky right now, traveling.
Yes, fairly here, fairly here. Got this gig going up here, but be back in Lagos next week.
That's good.
Yeah.
And your home is in Lagos right now?
Yes, my home is in Lagos. Yeah, but sometimes I'm in the U.S. because my family is here. My fiance is here, and so sometimes I come to the U.S. and sometimes to visit them, and sometimes I have some meetings I need to take care of. So I'm in the U.S. quite a bit sometimes. So about 2-3 times a year, I'm in the U.S.
Awesome. Well, that's not too bad, I guess. A little bit of
Yeah.
both. A lot of travel can be tiring, but I know it's going for a good cause right now. You're up to some really good things right now. And
Oh, definitely.
yeah, like super exciting. I'm hoping you can chat with us a little bit more about Render Health. You're the CEO of Render Health. And if you could just tell me, I find your story so fascinating when we chatted about it a couple weeks ago that I thought it was important that you share with us a bit about yourself. Let us know where this all started.
Thank you very much. And Jennifer, thank you for the time. I'm actually excited to be in the podcast and talk about Render Health. So before I actually dig into Render Health, it will be I want to kind of step back and talk about myself as kind of how I moved into the health technology part of it. So I was actually going to be one of you guys. I want to be one of you guys, a doctor. Throughout my childhood, I wanted to be a doctor, and my parents always kind of threw this little thing like, "Oh man, there's no doctor in the family. It'd be great, if the first one came out of our family." So, and I've always loved healthcare growing up. So went to college. I majored in biology. I actually got my associate's degree in pre-medicine, did the whole med school route, shadowing doctors, doing volunteer work, the whole thing to stack up your resume and get ready for med school application. So I remember, so my junior year in college, my second semester, I would never forget this event. I was in the science building. I think I was going to a class, and I saw this poster, and it was this Google event. Was partnering with Georgia Tech, so I went to Kennesaw State University. That's where I graduated from. Georgia Tech is one of the biggest tech universities in the state of Georgia, and I just walked in the hall, and they were talking about, if you had an idea, you wanted to brainstorm with someone about it, as tech wise, you can partner up with people. And I partnered up with someone, and it kind of just brought back the tech part of me, which I actually had as a kid. And I kind of got back to my hostel that night and started rethinking the whole thing. Like, oh my God, I think I want to go back to tech. I want to be in tech. But I still had a passion for healthcare. So I literally went on AliExpress is where we kind of log in for class. I logged on, and the second semester of my junior year, I changed my major from biology to computer science. I had 1 year left. I was prepared for the MCATs and all that, studying, and I just like, you know what? I'm going to tech.
Wow,
Um,
that's a lot of courage.
yes, yes. But at that point, till today, I don't regret doing it. But so I still had a passion for healthcare and I wanted to be in tech. So what I was definitely going into was definitely health technology. I wanted to kind of, coalesce both of them together. And so ended up, getting my minor in biology and my kind of major in computer science. So I ended up staying like a year and a half in college to get my degree in computer science. So after I then graduated, I ended up working in biotech. See, I kind of went back to the healthcare part of things. And so what I did mostly in biotech was I worked for this biotech firm in Iowa. I was there for a couple of years, where my job was to actually travel to different hospitals across the United States, and I was reviewing patients' health records in connection to what we call IPs, investigational products. So I work specifically in oncology. So throughout my years in biotech, I have reviewed different patients' records. From I work in breast cancer, prostate cancer, melanoma, leukemia, and I also did some ped studies. Actually, most of my ped studies were in Children's Healthcare of Atlanta. Fortunately, being in Atlanta, and that actually kind of started like kind of drawing me back into healthcare. And during that period, I worked with different EMRs, the big ones. I've worked with Epic, the Cerners, and other EMRs. Kind of that was where I went to review the patient's charts. And so there was a specific time I went back to Nigeria because my parents live in Nigeria. And I went to Nigeria and I think I went to the doctor with my dad. And the whole registration process was actually still the same when I left Nigeria at the age of 15.
Wow.
It was still, yes, it was still, you get to the hospital, they ask for what's your card number? Meaning like, what is your file number? They call it card number. And I'm saying, man, this is almost more than 10 years after and there's still no progress. And also me being in biotech kind of spun the thinking of, okay, like if you want to basically do clinical research in Africa, in Nigeria specifically, where I was from, if you still use paper records, it's still going to be tough to begin to get clean data to begin medical research. And off of them was when I started like thinking, I was like, you know what? Let me start looking into EMRs in Nigeria, digital health record systems. How many are they? Who are the major people in the market? And it was not a lot. For the most populous country in Africa, we are not doing very well on the health technology side. So I kind of took it upon myself, like I'm going to build this. I'm going to do this. And so from then on, I started, talking to doctors in Nigeria, and that was kind of what led to the idea, because I said, you know what, with so much diseases in Africa, great we need to find a way to house clean data that could be accessible as far back as when needed to be able to conduct proper research. And this kind of was what led to the idea. Like, you know what? Let me start. This is the first process, which means like digitizing health records, and then maybe take it further into like clinical research. So that's kind of where the whole Render Health started as a company.
Wow. So how long ago would that have been now from today?
That
You
was
had that
I
moment.
that moment was 2018.
Okay, so not
2000.
so long ago, only 3 years ago. So
Yeah.
I really love how you come full circle basically. You thought you would be on the front lines, your family encouraged that. You were about to, you were in school for that, you're about to write your MCAT, you invested so much. Didn't really complain about it. It's not like you had doubts, you just were doing it. And then something else came up that you thought, oh, and it kind of triggered a memory from your childhood. And I love how all of that is connected. And then
Oh,
yeah, and
yeah.
then
Thank you. Thank you so much.
going back to Nigeria with your parents, and then recognizing how you can be of service there, right?
Yeah,
Wow,
definitely, definitely.
that's
Actually, like, so just to kind of piggyback and like, so the idea actually started in so 2018, 2019. Started doing a lot of research. I was like, then I had to have to fly. I had to have to fly over to different states to go to different hospitals. So I would kind of push my schedule. I would fly for like 2 weeks. So I'll pack all my work within 2 weeks, and I'll pay like a week, and I'll fly to Lagos and like work from Lagos.
Wow.
Yes, and wow, so it would kind of work well for me because like it's a 6 hour time difference
Okay.
between my company in Iowa and Nigeria. So usually by 1 o'clock is when I have to resume work on my when I was working from home. So I
Okay.
have to kind of relate with my clients, the hospitals that I'm working with, and then so in the morning time I had time to basically do research and talk to doctors. So 2019 was when I late 2019 was kind of when I actually like left my job in the US and packed up my bag and baggages, told my apartment I'm not renewing my lease and I moved back to Nigeria.
Wow, like I said earlier, that takes a lot of courage to make such a bold decision and not to just desire it, but then to follow through on it. And I love how it just started with you doing research. Like maybe not at that point did you have the company in mind or anything like that, but you just knew what your mission was, if it's safe to say, was to
Definitely,
advance.
definitely,
Yeah,
definitely. That's correct.
that's awesome. So now here we are. So you started in 2000, you quit your job in 2019 to start this on a full-time scale. And then Render Health eventually was developed. So can you tell us more now about that, where you're at now?
As of now, we kind of have over 25 hospitals kind of actually using our platform right now. We're actually making revenue. We've actually, Amazon, we worked with Amazon. Amazon kind of got in contact with us. Like they gave us a bunch of credits to be able to, build our platform. Yeah, so we are currently we're only in the private sector right now. If we kind of go back to before that, so one of the things that we did before we built this platform was we had to talk to doctors in Nigeria. We did not, I didn't want to be that guy that just brings a product from the United States
Mhm.
and take it to Nigeria as is and force people in Nigeria to use it. I feel like that would not work because we had to know what the doctors' pain points were, and how digitizing their healthcare system will help them do their work more efficiently. So one of the first things we did before we actually started the whole project was we actually did a focus group. So we did a focus group with about 20 doctors. I did it over the course of 3 days. We did a session in the morning, session at night, in the evening, and then the following day. So it was a Friday and a Saturday, and we talked to doctors about what are the pain points, and off of those data sets that they gave us, and was what we used to build the platform because. We know how and I've worked with different healthcare providers here, and they complain about how some EMRs could be so annoying and frustrating, and we didn't want to build something that, when we take it to Nigeria, we're going to go through the same pain points as the doctors here were going through. So we had to be able to talk to doctors. But we had like the young doctors in the focus group session, the older doctors, and kind of had to get to a median where we could build something that works for both groups and could be difficult to use. So we had to simplify what I learned here and kind of make it much more easier to use. So yeah, so that's as far where we are now. Like I said, we have over 25 doctors. We have and this doctor is using the platform on a daily basis. Another aspect of Render Health that we've not mentioned. So in building this platform, our advisor told us that we had to kind of have a health insurance part of the business. The health insurance market in Nigeria is actually currently is on the rise. So another thing that what we did was we actually built a platform whereby health insurance have their own end and could receive claims
Okay.
directly from healthcare facilities that they work with. So most health insurance companies, a good amount still use paper claims, whereby the healthcare provider, they get the patient information. Once they get authorizations to treat the patients, they'll have to create a bill and invoice in paper and then mail it to the health insurance provider. So we actually provided a platform for health insurance companies to be able to kind of manage their enrollees and like assign those enrollees to those healthcare facilities so the healthcare facilities could send them bills and claims for processing. This kind of helped the health insurance providers kind of reduce fraud and saving time, basically making their business more efficient.
Yeah, and that's all
And
integrated in the EMR. So it's
yeah,
directly, like the providers directly billing,
Yes, yes,
basically? Okay. And
yes,
just to specify too, this is obviously all private, in
yes. It's
terms of
all private.
the hospital
This
system
all
right
private.
now? Okay.
Yes, yes,
The other thing I was going to ask is, so in terms of what Render Health then is all about, so it's an EMR system for healthcare providers, hospitals, for insurers, in terms of electronic documentation, and it's also for patients. Is there a portal for
yes, yes.
communication anywhere? Okay, so can you talk more a little, like, about that? And because I do remember when you and I chatted, you had mentioned when you were chatting with physicians, what you something about when they would chat with patients, they wouldn't necessarily write things down or put things on scripts. And so I was just wondering if you could elaborate on that.
Oh, definitely. So like I said, the focus group was very, very insightful.
Right.
I would, if anyone is trying to build something in Africa, I think one of the first things, you cannot take what you learn here and take it there. It wouldn't work. So obviously here in the United States, a patient has access to the records, except the doctor kind of hides it from there. Automatically, a patient has access. So one of the questions we posed during this focus group was, what are your opinions with patients having access to their record? It was a huge unanimous, oh no, no, why should they? No. It was a kickback. And I stumbled on that, like, oh, what? That's a problem here, and I wanted them to elaborate. And what I got was this: they say once patients get access to their records, one of the things they're going to do is, especially they feel like the ones who are not so intelligent, like that, maybe illiterate
Mhm.
ones that are not. What they will do is when they get those paper records, they will kind of, if they see that they have the same symptoms, they will just immediately go purchase the medication that was given to them.
Okay.
So instead of them going to consult, maybe they could be the same symptoms, but could be for a different disease, and they might need a different medication. But they said if patients have access to those records, they could just go to the pharmacy and just, you know what? Oh, I have access to these records. This is always headache check, coughing check, nosebleed check. Okay, I'm just going to go buy this medication because this was what the doctor prescribed. And most pharmacies in Nigeria, not all of them, you don't need a prescription to
Oh,
go there. Yes.
okay.
So, so you can just go there and say, "Hey, I need some antibiotics," and they just give it to you.
Really?
Yeah,
So they don't need
yeah.
so they don't need the oversight of a physician, like the pharmacists don't over there.
The the major pharmacists, they need scripts, but
Okay,
obviously not everyone is. Not, some of them they're just in the business to make
right,
money, so they don't really care for the script.
right, they're not regulated. Okay, gotcha.
Yeah.
Yeah.
So when we started, like, we talking to the doctors, and they told us that they don't want patients to have access to their records, and that was an adjustment we had to make from building the platform. So we made it whereby anytime a health record is entered digitally, the patient does not have access. So now this kind of leads to the patient side of it.
Mhm.
We are actually the first healthcare company in Nigeria to have both a patient portal, both on the web platform and in the app. So we actually have an app for iOS and Android. Yeah, so you can actually download that right now, and there's actually a web portal for that. And that portal actually allows for telehealth services.
Oh, good.
Um, yeah. So another thing, and I think we get to the public sector. That's one of the things we want to kind of help healthcare centers that are in like remote places, so they could connect to doctors in the cities and like be able to talk to doctors, and they'll be able to pick the scripts around them. We actually built a patient portal, so this will allow patients to actually schedule an appointment with their doctors, and they can look for verified doctors within the Render Health network. Because before we onboarded a hospital, we actually verify if they're actually a real hospital, not just like they just, I just have a building and slap a name on it and call it a hospital. So we actually help patients find trusted doctors around the area according to their specialties. Patients could actually schedule appointments. They could view their health record if their doctor gives them the permission to do that. They could view their medical bills, pay their medical bills, and we actually have a cool feature called Health Diary. I kind of got this cool idea from when I used to work in biotech. So back then, we used to when we used to work with some melanoma patients, they had to chart when they took the IPs and write their reaction to it. So my job anytime I went to this clinic was I had to review all these patients' health diary and see, okay, when they took it on day 17, I need to see how the patients were feeling before I can, call my manager and let them know, okay, I need to make a judgment call. Like this patient should not, they're having a bad reaction to this.
Mhm.
So what we did is it kind of digitized that, whereby a patient could actually say how they're feeling and chart it and like document it. So we have a rheumatologist currently on the platform, and a rheumatologist actually likes this platform, this specific feature, and they tell doctors to monitor certain activities over a couple of days. So they say, "Oh, take this." So they take a picture, and then if it's swelling, just take a picture of it and chart and like log it in. So before the appointment, they just attach all those documents to the doctor. So before the doctor, when they before they pre-chart, they could look and kind of see a trend. Okay, like okay, it's kind of working, and they can keep their treatment on, or they can see okay, it's the swelling is not reducing or something like that, and they have to switch it up. So that's kind of a cool feature that we have. That's probably not here in the U.S. I guess.
Right. So that enhances the communication, though. And
Definitely,
that's awesome because it's in the patient's voice and it's in their, they can freely write how they're feeling. Like you said, I like the term diary because that's basically, how they're expressing it, right? But it still
definitely.
supports the physician. So just to be clear, in terms of patients accessing their data, like you said, it's different here in North America. We
Mhm.
actually have been told in a way that patients are the data, like you are your data. So in Nigeria, they're still not there yet. Okay, or not there. Period.
It's still a hard push. So it's very interesting. Younger doctors, because I've had conversations with a couple of doctors, younger doctors are like, yeah, I don't mind that. But the older ones say, no, it's a hard no. So I
Right.
kind of, I might be wrong, but I think as time is going on, I think that perception will change.
Yeah.
Might change, but I think the younger doctors are more accepting. Like, yeah, sure. But the older doctors are kind of like still a kind of a yes, no kind of thing.
Yeah. And that's the thing in healthcare. IT, I feel, is a very quick world. Like things move at a fast pace. You're always thinking ahead, it seems, and you're always envisioning something for the future in a way, and then you
Definitely.
basically create it, right? But I find in the system of healthcare as a whole, it's all human beings, right? At the end of the day, and I do find that things in healthcare, even if it's just perceptions and perspectives and biases, they take a longer time to come around. So I think the fact that you have the diary is a really cool adjunct right now to start opening that line of communication both ways, which is really,
Definitely.
really cool.
Definitely.
Uh,
And then another thing we actually kind of added is we added this communication feature whereby patients could actually send messages to their doctor, and the doctor can actually view those messages and respond back to them. It's not been quite catchy yet, but obviously, like, over time, it's something that will improve communication between patients and doctors.
Great. Yeah, I have a good feeling about that. I think it will, based on what you're sharing. So, when you, from a physician burnout perspective, when you introduced this EMR system, was there pushback at first about going to electronic health when everything was so paper pen? And how has that changed or improved since you've implemented it in terms of burnout or stress on providers?
Like I said, I have kind of worked with a lot of healthcare providers in the US before I moved back to Nigeria in my field. And burnout, especially charting, it's a huge, huge thing. And one of the things I tried to analyze was when I actually talked to the doctors during the focus group and tried to address that. We don't want to build something similar to what they have here in states in North America in general, because that it's I would say it's working, but obviously some physicians are like, we have to do it because they have no choice. You know, in Nigeria, they have a choice. They don't have to use it. So if it's not that, over here, North America, it's like most hospitals, they force you to use it. In Nigeria, they don't. They're just like, we want your product. It's not serving us. We're not going to use it. So one of the things we have to make it so much, much simpler. So we built it whereby there's not so many tabs, and most of the nurses could do most of their work for them. Meaning the patient comes in, they already did the vital signs. So by the time the doctor takes over, see the vital signs, put in the notes, and then they send the information to the accounting department to bill the patients and wrap up the visits. So that was one of the things we did to make sure that it is not like, so you don't have to, there's not this hard stop here. You have to do this before you move to the next step. We didn't build all that in there. We wanted something simple because our focus is emerging markets. You don't want to build a product for an emerging market and build it that is going to be so much complicated to use. And so we focus specifically on listening to our doctors and letting them listen to their pain and fixing those to make sure that it's very easy for them to use. And we shifted a lot of the not a lot of the work, but most of what the physician is supposed to do to the nurses, like I said earlier. They do all the they did the vitals, and also the doctors don't have to worry about the billing part. They just kind of tell the nurses, hey, bill this patient for this, bill this patient for that. So kind of let me throw this in there. So most hospitals that use our platform are not 100% digital. So I need to put that in there. So this use some kind of paper. So on the paper, they might just tell the front desk, bill the patient for this, that, this, that, and then the nurse gets the note, puts it in there, and then bills the patient. So it it reduces what the doctor has to do and simplifies everything else. As far as the way that it's gonna help the process, whereby anytime a patient is, especially for telehealth, once the record is in the patient's chart and they're doing the telehealth, they could just refer back to the patient's record without at home without having to be in the hospital. So that's one of the things that it's kind of helped out with doctors. I think those are like the major points that it's kind of helped doctors, especially in Nigerian market. So one of the major reasons why most hospitals cannot go 100% electronic is obviously infrastructural problems. So not all hospitals have 24-hour power. So internet is the thing. Most hospitals kind of have internet now, but 24-hour power is one thing. Some hospitals kind of have 10 hours of power. Some have 24 hours. So that's why most hospitals cannot go 100% electronic. So there's some times whereby they will paper chart, and then like after maybe when there's power, they upload that information into the patient's chart. And so one of the things you see as far as pushback is, one, there's some older doctors, they like the platform, and they think, man, this is something that's going to be tough for me to use. And some of them will hire someone who is younger in the front desk to help them navigate the process. And like maybe they could be sort of like a scribe for them. So they create a process to simplify their work for them, while our process actually does not make it hard for them to comprehend. I don't know if that kind of makes sense, but yeah, that's kind of what we did to make sure that we reduce burnout for the healthcare providers.
Yeah, that makes sense. And I appreciate, though, that you took the time to do the focus groups, to take in the feedback, and that you also learned from your previous experiences in the States and how, the mere fact of clicking, for example, in and out of tabs and having all of that open is one of the big reasons for burnout and fatigue and exhaustion, is because it's too much, right? It's just too many tabs open, too much clicking going on. So things like that are helpful if you can minimize it, even if it's coming potentially from an infrastructure standpoint at this point. But I think it would make most sense to start simple and then to build the platform with ongoing feedback as you go along, rather than start it out complicated with all of this stuff going on, right? And having to undo all that.
And that's exactly what we're doing every time. So we have some of our team that work with us, we call them CRPs, client relationship personnel. We always encourage them, get feedback from these doctors.
Mhm.
Go back to the hospital. What issues are they having? And are they not okay? We see that they're not using this. Okay, ask them why they're not creating that much appointments for their patients. Why are they not, putting in the medication for this patient? Is it that the platform is so hard? And then the feedback we get is what we put back into the platform. So we're not going to say that Render Health is a platform that is 100% built. No, we're still a baby. We're still learning, and the feedback we get from these doctors and what we use to improve our platform.
I love that. And I love that it's your take, like you have Render Health, and then you have the physicians and like the staff and providers. And you also have the patients. And are the patients at all? Do you have any feedback from patients using the system, even through the doctor, what they're
So
saying?
one of the things, so the patient side of it has not been as active because we actually just went live, and so we built the platform. 2019 was when we were learning. 2020 was mostly like pre-selling the platform and building. So we feel that we actually went live in October 2020, and so till now we've had some patients use it, but we've not got enough feedback from patients yet. So one of the things we've been telling doctors is, hey, do you know this is available to your patients? And they say, yeah, they know. So so one of our goals is try to, encourage patients to download the app and show them how they could connect much more with their doctors using the app or the web platform.
Right. So it sounds like too, you're just getting it out there essentially and just exposing yourself more, right? And render.
Definitely, definitely. That's exactly what we're doing. That's
I'm
exactly what we're
happy
doing.
for you. So you had said that initially when you were working in biotech that you were extracting clear data through technology, basically clear health
Yeah.
data to support patients in ailments and things like that, medications. So at this point, do you have like, are you finding that you've been able to do that? I know that the patient enrollment isn't very high, but do you see that you're able to start extracting some health data that will be valuable to Lagos and Nigeria and the residents?
So as of now, I'm gonna say we have not. So we have over 5,000 health records currently in our platform. But
Right.
what we're doing is we're not too focused in that part yet. So it's like a step. So what the first part we focused on right now is building the platform, learning from doctors. So once we get to the level whereby okay, we're comfortable with this part and we have a good amount of hospitals, they're using this, and like I said, we'll get to this later, like we're moving into the public sector, and once we feel comfortable with that, then we can start saying, okay, we can start analyzing the data and say, okay, this is the disease that's most prominent in this area. We can, help the local government in this area, like, hey, maybe typhoid is the most common disease in this area. Maybe you need to improve the water in their area. Oh, malaria is this. Maybe you need to give these people mosquito nets and stuff like that. So that's kind of that's what our future goal is. But one of the things we just want to kind of take it step by step till we get to where we want to get to in the long term.
That's awesome. I love that. I really don't have many more questions to ask you. That was going to be my question. I don't know if you basically answered, but where do you see you're clearly a guy with a vision. So okay, so
Thank you.
I'm not trying to take you like too far ahead because I know we got to ground ourselves, and I know that you got to build this from the bottom up. But what is your big vision for Render Health? What are you like when you think about it? What does that trigger inside of you overall?
Oh man, so the big vision for the company, and we're actually working towards that. So, like I said earlier, one of the things we're doing right now is we are currently in the private sector, and for us to be able to, we've been talking to the public sector, we've been talking to some state governments in Nigeria to be able to begin PPPs, which are like some private-public partnerships, where we work with the general hospitals because the public hospitals have a ton of patients. I mean, so public hospitals are very, very affordable for most people, but so they're very cheap, and that's where the ton of the volume is. So what we are trying to work with them to be able to implement our platform in those general hospitals. So we've been definitely getting a lot of positive talk. So
Right.
towards that's what we'll be doing towards late this year to early next year implementation and starting pilots in those states. And once we get there, I think that's going to actually move us to our next level, whereby we see ourselves kind of working with different like the World Health Organization, helping them provide insightful data to be able to better get data to be able to help communities stay healthier, help state governments, if there's a connect people in remote areas so they don't have to spend the money that they're supposed to use for the treatment as transportation, because the way it works is, especially in like in some states, is there's the main hospitals called general hospitals, and there are some, I'll call them satellite clinics, whereby they're much more close to the small towns, but they don't have the equipment and the doctors are not there all the time. So we want to kind of set up these teleconsultation stations where, patients will just go there and receive teleconsultation, appointments, and then they'll be able to kind of get their drugs or, and so that's what we're looking for, is to basically create a way whereby we can organize the data, provide insightful data to be able to get people to be more healthier and, create a healthier community, and also move into basically clinical research whereby, if there's a new disease, we have the data, we partner up with the state governments to be able to get into clinical research to be able to find cures for the diseases. So that is what we are looking at long term. Definitely that's our goal. I don't want to call it a moonshot, but it's up there.
It's on its way. That's for
Yeah,
sure. And I
yeah.
mean, I appreciate you being here so much. And I really
Thank
love how, again, like how it's all led to helping others and serving the community and, being a proactive member and trying to uplift health in areas that need it most. I think that's so cool. And so if people want to connect with you or learn more about Render Health, where do you suggest they follow you or connect?
Oh yeah, so anyone could go to our website, just renderhealth.com, like Paul said. So just render RENDER health, render health, and on any social media platform, Instagram, Twitter at render health. Yeah, so you can always reach us there, and yeah, just check us out, see what we're doing in Nigeria.
Thank you so much. It's been a pleasure having you. It's been great chatting with you again. I love your energy.
Thank you so much. I appreciate it.
So if you guys like this podcast, please subscribe and leave an honest review. Your feedback means everything to me. Your reviews are what moves this podcast forward, and I always appreciate receiving them. If you want to get a hold of me directly, reach out to me on social media. My handles are in the show notes, and you can always subscribe to my weekly newsletters at jennifergeorge.co so that we can stay connected. So until next time, thank you guys so much again for your ongoing support.